Primary care transformation versus cost cutting. Who will reign supreme as our champion trend for the upcoming year?
Cost cutting, I would say closer to, yes. Even though I'm a big supporter of the primary care transformation, I'm surprised that one made it. Yeah, I think if we did it all over again and started from school, we'd come up with a different two. I really do. But all of us picked healthcare economy as the strongest region in the beginning. Yeah. Remember that.
That's right.
Yeah.
So it'll be very odd if that doesn't make it as the champion.
Yeah.
But, sorry, go ahead, David.
Not surprised about cost cutting. I had that as a Final Four. Huge advocate for primary care transformation. It's it's attractive to choose that one as the winner because depending on who wins this one, one's a very pessimistic reality to healthcare and one's optimistic. One I think is part of the solution for the future. Last year we were in that same spot. We ended up with a champion that largely was a negative.
Workforce. That's right.
And I think we're going to end up there again. And I think it's just it's an indictment of healthcare. It's not a good story for me that cost cutting is going to be the number one trend in our eyes this year, but it's probably reality. And I think it speaks to how far we have to go to get healthcare on the right footing.
Looking at the cost cutting and the affordability, cut from the same cloth in terms of, where we really need to be focused on creating sustainable systems for healthcare and making sure that we're doing that proactively. I think that if I'm looking here at, it was primary care and cyber, what I see is us sort of responding there to what I would call some environmental factors. Right? And so one needing to be in a more defensive posture around cyber and one having the more offensive posture around primary care. So it's just sort of interesting to me just how they sort of lined up on each side of the aisle, as it were. I do think that right here, right now in 2023, the main priority is going to be in cost cutting or cost avoidance. And because we are in the situation that we are in, it is a serious situation from a healthcare finance perspective. And my hope, even though I do intend to vote for cost cutting as the trend, is that we proceed with caution in that, and that we do not sacrifice quality and safety at the time when we are kind of getting out that red pen and figuring out where we go from here. So let's not step too far backwards, because we have a lot of gains to make moving forward.
Agree with all of that. I'd love for the story to be around PCP, transformation and really material strides in value-based care and, getting away from RVU models and really, putting our money where our mouth is on value-based care and quality care. I just think the immediacy of some of the challenges right now are not allowing us to get out of our way, to focus on those things that do support longevity of the system, just because of the financial challenges that are in front of us. And as Dr. Carmouche has mentioned a couple times, the safety net of the government dollars are gone. And it just has created, just a challenge across the industry. And it's not just for providers. I mean, look what happened to some of the MA plans, this past year. I mean, it's having a ripple effect across the industry.
Yeah, and I think that because we have been, we're still in the journey, but has not been as effective as we could be with really critical issues like primary care transformation, and we don't have alignment among stakeholders of what that looks like or how we get there on what timeline and how we're handling the financial component of that and reimbursement and all of those things. It's going to put us in the situation of the every man for themselves approach, which is cost cutting, right? What can I do today to stay in the game? Yeah, it's a tough situation.
It puts such an advantage on the disruptors. Mm-hmm. I mean, when you think about what Walmart's doing, you think about what Amazon is doing, they're taking a long range view of how they want to play in the space while everybody else is thinking about what are they doing tomorrow. I mean, there is a significant advantage on the disruptors right now, being able to think freely and plan long term versus those organizations that are living to, are fighting to live another day.
Well, when you don't have the legacy infrastructure,
That's right.
you can, jump right over the top of that and create the future that you want to see.
Oh, so what else is, I think, embedded in there is just diversification and diversification of the model, right? So Amazon clearly has tried healthcare a number of times, has not been successful, and now has bought another asset and also trying to expand on the pharmacy side. But you think about what Optum's done over the years as well, right? Optum has gone from not just the data company, they own multi-specialty clinics. In our neck of the woods, they own quite a few high-profile specialty clinics. You have the vertical integration that's happening. You think about all of those put together, you have anybody who has the capabilities, capital like that right now, going after diversification. And then what we're going to look at if we think about 2024 and 2025 is going to be these behemoth companies that have a number of different things that they're selling to us or touching us with, and the same way that Amazon can. So I wonder if that ends up being something that we see on 24 and 25 is just
Could be.
pure diversification by the really large healthcare entities.
The other thing that's going to be interesting to watch is like how do hospitals make it? High capex, high labor costs, low margin, super subspecialized workforce. And yet here we are in the third year of a pandemic where hospitals have never been needed more. All of the stuff that I think others can do better than hospitals is going to be done better than hospitals. It'll be pulled away. But all that stuff is what allows hospitals in some ways to exist in an ecosystem where they make money or it can survive and subsidize their own operations. So it'll be interesting to see like what actually happens to the acute care hospital in America over the next few years.
Yeah, I think, obviously we've all seen it. There's a place. I think there's going to be a huge asset rationalization that needs to occur with the bricks and mortar, but at the end of the day, there's going to be emergencies. There's going to be procedures. Most of them are moving to outpatient, but there's acute needs that are going to be prevalent. And to your point, Dr. Carmouche, they could just be a commodity, site of care that is always under a fee-for-service model, but that fee-for-service payment is coming from Walmart. It's coming from Amazon to utilize their bricks and mortars for those really acute patient needs.
Yeah, and I think, David, you hit it right on the head, and hospitals are going to continue to struggle and close. But I think the next step for Optum and Walmart and Amazon, when they started out with primary care, everybody thought, well, that's just where they're going to stop. Now they're buying multi-specialty groups, like you said, they're buying large IPAs. Well, they're never going to go beyond that, and then they start buying surgery centers and urgent cares. To me, the next logical step is micro hospitals and what happens there. So I can think of half the rural hospitals in America that could be replaced with a micro hospital, which is why the CMS rural model just came out, right? It's kind of a critical access on steroids. Hey, we'll pay you cost plus a certain percent, and you just do outpatient services and observation, and that's it. Well, I can see the big folks with the capital and the PE money, let's start building some micro hospitals, some new, shiny, beautiful hospitals in the rural area where we're only admitting 5% of the patients anyway, or hospitalizing 5%. So let's take all of that. Now that can make money, and then it's going to get to the point where your tertiary centers are only taking care of true sick patients. And you're going to see the rural inpatient programs pretty much go away. And so I do think the Walmarts and the Amazons of the world the next step would be to start getting the hospital side of business, but not in the hospital that we think of.
There's going to have to be some shifting of subsidies. I mean, there's going to have to be a subsidization of the acuity that you'll see in a hospital as the population ages, and you get medical ICU level patients largely in tertiary facilities. The current reimbursement model doesn't cover the cost of care delivery there. So you're going to have to be able to pay those centers substantially more than we pay them today. And that money is going to have to come from from somewhere. And to me, that's got to be a shift away from subspecialty driven, procedurally oriented, high margin care. I just don't see where else you're going to pay for that hospital care.
You guys ready to vote? Okay, let's see who takes it. Cost cutting versus primary care. So cost cutting is your black, primary care transformation is your red. Cost cutting, cost cutting, cost cutting.
David, you're stabbing the doctors in the back. That's okay.
Under duress.
I hear you.
Cost cutting.
Blowout.
In a blowout. Our thinking when we started the firm was there is so much complexity. Is there an opportunity to boil that complexity down into a handful of or 3 salient parts that are most meaningful to whomever the organization is that we're working on? And our effort here is to do exactly that. Take a lot of the complexity and help organizations understand that some of that complexity could be boiled down if we could just think about these handful of things this upcoming year and maybe balance the difficulty with a bit more aspirationalism. I read a book to my little boy most nights that oddly is an adaptation of a Leo Tolstoy book called The Three Questions. The 3 questions in that book, it's all about the children's adaptation is about a boy named Nikolai and how Nikolai traverses talking with his different friends and trying to understand the answer to 3 questions that he's endeavoring to just figure out that help him understand life. When is the best time to do things? Who is the most important one? And what is the right thing to do? And at least in our estimation, if we think about when is the best time to do things when it comes to change in healthcare, in our minds, that time is now. Who is the most important one? I could certainly make an argument that the patient is the most important one on any given day. The provider is the most important one on any given day. The quality professional is the most important one on any given day. But at the end of the day, I would suggest to you, it's the one you're with, that's side by side with you, dealing with whatever the challenges are that the industry presents itself. And then last thing is, what is the right thing to do? What I would submit as we depart is the right thing to do is to change the way we have done things thus far in healthcare. It is too complex, too difficult, too challenging, not understandable. So if we could just figure out a way to simplify, if we could just figure out a way to think both aspirationally and about the challenges that exist in a much more refined way, then at a minimum we'd be doing a little bit better tomorrow than we're doing today in the industry. So I'll leave you with that. This has been unbelievable, the experience to be able to share time with all of you. We've just immensely appreciated sharing time, sharing thought, and hopefully having a little bit of fun in the process. But we appreciate it and hope that we get a chance to convene again next year and see how we did.